Everyone, my name is Mariah Murray and I'm a second-year Masters of Public Health student at the University of Arizona focused on epidemiology. This summer I was blessed with the opportunity to study in Garbaya, Egypt, and my project focused on identifying the spatial relationship between liver cancer, hepatitis C infection, and environmental contamination in Garbaya. So here is the study location in Garbaya. We have Tanta, which is about an hour and a half outside of Cairo. And these are the 8 districts of the Garbaya Governorate. So a little bit about liver cancer. Liver cancer has the highest cancer incidence rate in Egypt, and it is also on the rise. Some of the symptoms seen in liver cancer patients include yellow discoloration of the skin, unexplained weight loss, and abdominal pain and swelling. Studies have shown that the main etiologic agent of liver cancer is hepatitis C, and previous studies have shown that there are high levels of heavy metal and environmental pollution in the region of Garbaya. So the goal was to find the relationship between the heavy metal contamination and liver cancer, which a lot of the liver cancer cases are caused by this hepatitis C infection. So that was my focus for the 8 districts of Garbaya. And specifically at the Garbaya Cancer Society, the registry had 4,943 cases of liver cancer from the study period of 1999 to 2010. Egypt is also projected to have 35,000 cases by 2020 and 85,500 cases by 2050 of liver cancer. So the initial research question is there clustering of liver cancer cases that relates to this spatial distribution of the environmental contamination and the hepatitis C rates? So my hypothesis in the beginning was that the incidence of liver cancer would be higher in the urban areas, which would be more heavily polluted in Garbaya, along with having high levels of hepatitis C infection in the urban areas as well. So a little bit about the methods. We used the Garbaya Cancer Registry data to study the population demographics. To first calculate the incidence rates, we used the district-specific data about the population. So we used the number of cases in each district as the numerator, and for the denominator, we used the CAPMS census data to calculate projected populations. So we had the information from 1996 census and 2006, and we used the population formula to estimate the population for rural and urban from the years 1999 to 2010. This served as our denominator, and then those number of liver cancer cases from the Garbaya Cancer Registry served as the numerator for the incidence rates. So this is a little summary of my data conclusions. So if we look at the crude incidence rate of liver cancer in Garbaya, it's very interesting to see the spike in liver cancer from 2002 to 2005. And this is something that we want to further investigate as to what was going on here to cause that spark in the number of liver cancer cases. And then if we break up the urban and rural incidence rates of liver cancer in Garbaya, we see that there is so the green line is for the urban and then the red line is for the rural. So we see there's also a steady increase in the rural area up into that 2005. So that would also be something that we would want to investigate further if there's a relationship between what is going on in the rural Garbaya opposed to the urban Garbaya. So if that's related to the hepatitis C rates, maybe migration, if there are things that change in the lifestyle factors of those populations. And these are my initial results. So here again is the map of the 8 districts of Garbaya, and I have color coordinated so that you can see which color goes with which district. So these are the number of urban cases of liver cancer per district, and then the number of rural cases, along with the overall incidence rate of liver cancer per district, the crude urban incidence rate of liver cancer, and the crude rural incidence rate of liver cancer. If we look at our initial results side by side, we see the crude urban and the crude rural rates for each of the districts, and consistently across 7 of the 8 districts, the urban areas had the higher incidence rate of liver cancer. And so we want to look further into the urban areas and the relationship between the hepatitis C rates that are seen in the urban areas and the hepatitis C rates that are seen in the rural areas. Most importantly, we see in El Santa and we see in Couture, there are very high levels of liver cancer. So we want to look further to see what is it in these specific districts that are causing the rates to be that high. And also with 80.1% of our cases being male and 19.9% of our cases being female, we want to see if the male population may have more exposure to causes of hepatitis C or causes of liver cancer, which data has shown in the past has been linked to occupation. And the males are more in industrial occupations, so that could be an explanation as to why the rates are so high in the men. So for the future direction of the project, I am currently working with Dr. Wagida, who is in Egypt, and we're trying to get the district-specific hepatitis C rates, and we want to use this to compare against the liver cancer rates. So the idea is that if we see throughout all of the districts of Garbaya that the hepatitis C rates are constant, however, the liver cancer incidence rates are higher in certain areas, we will think, okay, what is that third factor? Maybe it's the environmental contamination that is leading to certain districts having such high levels when everyone has around the same rate of hepatitis C. Or maybe we will see that those districts that have the highest level of liver cancer are having really high levels of hepatitis C. So we want to get those rates and be able to make a map of the hepatitis C rates to kind of see how that is aligning with what we're seeing with liver cancer. So that's the future direction that I will be going with Dr. Wagida going into the school year this fall. And also we will use this to look further into testing the water contamination and maybe factory or pesticide relationship to heavy metal levels. And the research findings of this study can be applied on district and governmental levels to improve existing hepatitis C interventions and also to provide evidence for new policies regarding pollution. Egypt has a recent hepatitis C intervention program, and this data can be used to show if things are successful with the program, or then maybe things may need to be readdressed and there may need to be changes so that the hepatitis C rates can be addressed in Garbaya. So from this experience, I had a lot of learning experience this summer. I learned the importance of validating data, so finding errors in calculations and translation. Christina and I looked over the 1996 and the 2006 CATMUS census data, and we used that to do our own population projections from 1999 to 2010. And while doing so, we both found multiple errors in translation and a couple calculations that did not add up correctly. So just the importance of validating what you're using for your study. And we used the population projection formula, and we also cross-referenced each other's calculations. So I learned the degree of accuracy and how important that is to your research. I learned the cultural competency and value of diversity, so understanding and respecting that although a culture may be different from yours, you are in their country and in their home, and it's best to be respectful and understand where they're coming from with certain adaptations that need to be made with you being a foreign researcher. And also, as an independent researcher, I honed skills in problem solving and innovation. So every day you have to be an advocate for yourself and for your research. So you have to approach your mentors and be clear about what help you need and what direction that you're willing to go. So if you don't have that drive to push your own research forward, then sometimes it will be very stagnant. Also, which was very important to me, I observed the physician patient relationship and the sincere demeanor of the surgical oncologist. I was able to shadow a lot of my mentors who are also medical oncologists and researchers, and it was very interesting to see the dynamic between the physician and the patient and how the physicians handled telling the patients and their families such devastating news, even when they were doing surgeries for patients who were very late stage in their cancer cases. They still provided a sense of like hope and compassion for the family, and it was interesting to be able to observe them having such a calm manner with dealing with such severe surgeries and cases. Also, I learned to remain open-minded to change in project methods according to available resources once you're on site for the project. So for me specifically, it has been a little challenging with getting the hepatitis C rates for district-specific Garbea. So I knew ahead of time that I was going to focus on hepatitis C, but not exactly what was available as far as if I would have rates for every district available at that time. And when I first arrived, I did not have that, so learning how to be open-minded to change in the project methods and reaching out to collaborators to further your project. So here are some pictures from the Garbea Cancer Society. So these are a few of the surgical oncologists that I was able to shadow in surgery. And in the middle, there are our main mentors, Dr. Hablas, Dr. Ramadan, and Christina and I. An is the previous C student, and then of course, Dr. Solomon. And these are our mentors from the Faculty of Agriculture. And then these are some of the surgical staff team at Garbea Cancer Society. These are some more of our experiences. So this is Christina and I and An, who is the previous C student. And we did have a little bit of fun while we were there. Christina and I had the pleasure of going to see the pyramids and the Karnak Temple. And this is the Garbea Cancer Society, which is where we're working. And some of the strengths of the Garbea Cancer Society is that the registry is very strong and it's a reliable data source that was validated by IARC and SEER. And there was consistent organization and tracking of liver cancer patients' medical records. So when we arrived, there was a digital base of the medical records, and it included a lot of information about the patients that was very organized, and Dr. Ramadan was very articulate about his data. So that was a very strong database to work with that we were honored to work with. And there were very strong hands-on support from the Egyptian mentors at the study site. So Christina and I were placed in an office that was directly next to our mentors, and we were able to communicate with them quite often if we had any questions or any concerns about the project. Some of the limitations, again, were the errors in translation between Arabic and English, both numbers and language, and also me learning midsummer that the hepatitis C rates were not yet district specific, so I just had to navigate around that and make sure to stay in contact with Dr. Regita once returning to the US so that I can keep receiving information and updates about the hepatitis C rates for my project, and also navigating the dynamic of leadership etiquette. So again, this is a cancer society that's not in the US, so you have to learn like their leadership dynamic and how they interact with one another and adapt to it. By the end, it was an amazing experience. As Christina said, we were able to go into the office of our mentors and we could talk about the experience, the cultural differences, the research. There were a variety of things that we could talk about, but in the beginning, it's about observing and seeing what's the respectable demeanor to have when you're in a new country. And also, another limitation was there wasn't strong internet server at certain times, so I know there were certain websites that we wanted to use for population information that we could not access at that time, but yes, that was another limitation. So for my future career goals, so currently I am in the process of applying to medical school. I applied this past summer and I am pursuing MD, MBA dual degree programs. I would like to become a medical oncologist and focus on advocacy for increasing access to medical health care for underserved international and domestic populations. So in the past, I have traveled to Hong Kong, Taiwan, and Italy to do a healthcare system analysis and to just understand the differences between how the healthcare systems are ran in the US versus other countries. And this was really important to me with having a perspective of wanting to move more into being into the healthcare field myself. And with the MBA dual degree, I would at one point want to become involved in administration. So I think that would be like a very interesting viewpoint to bring to the table to understand how all of these international healthcare systems are ran and be able to compare the pros and cons to those in comparison to how we do things here, to kind of just provide a more open perspective to the table. And also I want to continue volunteering in clinical care practices in disadvantaged areas of the US and in other countries. Currently I live in Arizona, and I volunteer at a place called Clinica Amistad, and it provides health care for underserved populations in South Tucson. So I would like to continue doing things of that nature no matter where I live, and I want to continue medical missions work. I would like to give a special thank you to Dr. Solomon, who has been amazing this whole time. During my first year of my MPH program, I contacted Dr. Solomon very early on, and I was very excited about applying to the CEAS program. And even though it was so early and he was still working with the students who were actually in the program from the previous summer, he was still very kind, and he was still very helpful with me coming up with a research proposal and seeing what country I wanted to dedicate my research to. So I thank you, Dr. Solomon, for your patience and for being available to so many students, even though you have so much going on. So it's really a valuable relationship, and I thank you for that. And I also want to thank Ann, and she was a previous C student that I also met very early on in the process, and she helped me with introducing me to the maps of Garbea and understanding the Garbea registry and what variables, how to read the variables. And also she was in Egypt with us this past summer, and she really helped with the dynamic with the Egyptian mentors and bridging the relationship, and it was amazing to have her there. Dr. Hablas, Dr. Abraham, Dr. Shoker, Dr. Baruti, those are all mentors from Egypt on site. And then Dr. Ragita is the doctor that I will be collaborating with going into the fall semester to work on those hepatitis C rates. And I will be using that to make a comparison with my liver cancer incidence. And I am thankful for all of the assistance I have received thus far in the entire CEAS program. So thank you.